Question here. The nurse on medical unit has received the morning report. Which medication should the nurse administer first? There are 4 options. Which medication we give them first? Pantoprazole to the client on call to surgery. Calcium carbonate to a client reporting indigestion. Bismuth to a client diagnosed with ulcer. And famotidine to a client diagnosed with gastroesophageal reflexes. So first of all, here there are 4 options, right? Out of 4, which is the most priority? First 4 medication. Okay, so here pantoprazole, a client who called for surgery. The calcium carbonate, the client reporting indigestion. And bismuth, a client diagnosed with ulcer. And famotidine to the client diagnosed with the gastro. So number 2, 3, 4, this is not a emergencies. If you give the medication later, they will not die. But number 1, it is the medical priority. Why? Because your patient is waiting for any surgical operation, right? So as I told you, out of 4, number 1 is the answer here, because it is the pantoprazole is a proton pump inhibitor, a medication for a client on call for the surgery is a priority. The client surgery could be delayed if medication has not been admitted when the call to surgical operation. This is the reason, this is the emergencies. Which question number 3, which statement is the significant rationale for administration of proton pump inhibitor? So they said a patient need to give proton pump inhibitor like pantoprazole, omeprazole, rabeprazole. So who is diagnosed GERD, gastroesophageal reflex? So what are the reason you give proton pump inhibitor to GERD? 4 options. Proton pump inhibitor medication neutralize the gastric secretion, blocked H2 receptor on the parietal cell, and PPI medication inhibit the enzyme that generalize the gastric acid. And number 4, medication from a protective barrier against the acid and pepsin. So what is your answer, right? So out of 4 here we can see the number 1, it is the like gastric secretion. Proton pump in medication neutralize the gastric secretion. Proton pump inhibitor does not do this. Antacid neutralize the gastric secretion. And number 2 here say medication, PPI medication blocks to H2. No, antacid or H2 blocker block the H2 receptor. Number 3, PPI medication inhibit the enzyme that generate the gastric acid. This is the mechanism of action of proton pump inhibitor, right? Number 2 is a mechanism of action of ranitidine or H2 blocker. And number 4 say PPI medication from a protective barrier, forms a protective barrier against the acid and peptic ulcer. It is not a true, because mucosal barrier agents form a protective barrier against the acid and pepsin, not PPI. So only the mechanism of action, it is this one, right? So let me recap it. Proton pump inhibitor, how they work. They inhibit the enzyme that generate the gastric acid. But number one is a mechanism of action of antacid. Number two is a mechanism of action of ranitidine or H2 blocker. And number three is a mechanism of action of mucosal barrier agents. Next question, which statement is an advantage to administering H2 blocker or histamine blocker rather than antacid to a client who is diagnosed by GERD, gastroesophageal reflux? So what are the advantages of administration of H2 blocker rather than antacid? So answer, antacid are more potent than H2 blocker or relieve the symptom of GERD. So they said advantage of H2 blocker then the antacid, but number one, talking the antacid are more potent than H2 blocker. So this one, but we are talking about why H2 blocker is better than antacid. H2 blocker have a more side effect than antacid. H2 blocker are less expensive than antacid. H2 blocker require less frequent dosing than antacid. So which one is our answer from here, right? So first of all, let me explain one by one. So number one, antacid are more potent than H2 blocker. So keep in mind, H2 blocker actually block the production of gastric acid and have a longer effect than antacid. So it is not true. And number four here, and I mean, increase the, they said H2 blocker have a more side effect than antacid. So an increase in the side effect would not be the advantage. It's not would be the advantage. And number three, H2 blocker are less expensive. But you see, antacid is less expensive than H2 blocker. So number 1 to 3 is not accurate information. So remaining is number 4. H2 blocker require less frequent dosing than antacid. H2 blocker require less frequent administration than do the antacid, which require frequent administration or 7 to 9 more times a day rather than to H2 blocker. So for therapeutic, I mean, if you want to get therapeutic effect by antacid, need to more frequently use. And also keep in mind that fewer times a client is expected to make a medication. Nobody like too much time, right? Also, the more likely the client is to complain with medication regimen. So number 4 is the reason H2 blocker require less frequent than antacid. So we prefer for the treatment of GERD.